Haiti is not some exotic place that's halfway around the world. If your launch point is Miami, Port-au-Prince is closer than Atlanta to Miami. It took me an hour from Salt Lake City to here. I think it was an hour and 10 minutes.
Mm-hmm.
Delta Connect or whatever it was. That's how long it takes to get to Haiti from Miami. An hour and 10 or an hour and 15 minutes. So it really is right in our backyard. Haiti is the second oldest republic in the hemisphere, only behind our own. Haiti was born of a successful slave revolt, born in 1804, only behind our successful revolution. Our Partners in Health really began in Boston and in Haiti by Paul Farmer and others. He's one of 4 co-founders. Mm-hmm. But currently we're in 10 countries, Haiti being the longest place that we've worked. But what we fundamentally believe at Partners in Health and practice through our work is the question of, or the statement of, healthcare as a human right. Really, we strive to create an option for the poor in healthcare.
For Conj, I can say in 2006, for example, the most recent numbers that I had, there were about 1.8 million clinic visits.
Wow.
But they're not all in Conj. Zami Sante, which is the sister organization for PIH, they have spread out and they have a whole series of community clinics. They're in Belladere, Inch, Bukankare, Conj, they're all over the place. And so they do an enormous amount of care. I can say in terms of operations, surgeons in the last year did over 1,900 operations in Conj. And that's in Conj alone, and we have 4 other sites that we operate at.
I try to give some context. I compare and contrast the leading causes of mortality in Haiti today versus the leading causes of mortality in the United States 100 years ago. In Haiti, HIV is on the list of the top 4, but for the purpose of the discussion, we can take that off and say pneumonia, tuberculosis, and diarrheal disease are the 3 leading causes of death today in Haiti.
Okay.
And if you look back at information from 1900 of the leading causes of mortality in the United States, those 3 were the top of the list. So I make the point to say Haiti today is where the United States was 100 years ago, which 100 years ago we were in the pre-antibiotic era.
My first trip to Haiti was in February of 2008. And then I spent between July of 2008 and July of 2009, I spent about half of my time in Haiti. I'm trained as a plastic surgeon, specifically as a pediatric plastic surgeon.
Okay.
But in Haiti, you have to have a little bit larger tool set. So I did a lot of general surgery, everything from helping to do C-sections to deliver babies, all the way up to things like cleft lip and cleft palate repair for children. The transition was not that difficult. While you don't always have the equipment that you would use in the United States, there's plenty that you can use to get the job done, and I think it makes you a better surgeon. One of the things, just like with medical care, the surgical care we practice, our goal is to have first world surgical care, or first world medical care in a third world. And if we have to compromise, it's not something we're willing to do. You won't find that they use expired medications, mm-hmm. and you won't find that we do questionable or dangerous operations.
I think what's most difficult for me is that there's, some apathy out there. Partners in Health lives by the credo of doing whatever it takes, and we have to do whatever it takes. And so I can't say it's not my job, because it is my job in the end. And things that I have a gap in my knowledge about, say supply chain management, I talk to someone who does know. Our job is never done. We see ourselves as part of the solution, and in addition to so many other partners that I think that we have in this fight, we're encouraged by the progress that we've made and that Haiti is making, and we know and recognize that we have a long way to go. But that's just fuel for us to continue to work harder towards these goals. Change is happening. Change does happen. One large example, I think, is the seroprevalence of HIV. So how many people in the country at X time being now, have HIV? Currently, I think it's 2.3% or 2.5%. That's in 2009. 5 years ago, it was 3.5 or 3.6% nationally. The number is going down. And again, I think that's a testament to the government of Haiti and the other non-governmental organizations that work there, and the president's plan, President Bush's plan for AIDS relief, in addition to the Global Fund against AIDS, malaria, and tuberculosis. These programs in Haiti are working, and there's hard data to support that. Health to us is much more than disease and cure. Part of medicine in America, for many physicians, stops at the hospital door. And it really needs to extend well beyond that. In a place like Haiti, or rural Montana even, you really have to take into consideration the social forces that put people at risk for these illnesses. So why are you and I, say, not at risk for HIV and TB? We're shielded from risk when some other people who may live here in this area or in rural Haiti are really much more at risk than we are. Those are the questions that, the more probing questions one needs to ask if you're really fundamentally going to address some of these issues. How are we going to really affect the root causes of these diseases? And you really have to identify the non-health related causes. And poverty and gender inequality really as cofactors for chronic disease. They have a very deleterious effect, poverty, gender inequality, and serve as risk factors to put people at higher risk. And so what we try to do as an organization is not just, the buck doesn't stop with identifying someone with an illness and treating them. You really have to get down deeper into what's putting them at risk. These same questions I ask in Haiti, I think people should be asking in inner city Boston, in Helena, Montana, and other places, because I think we really have a long way to go to address these issues and recognize them as part of an issue of the healthcare of our nation or other nations.